feel for our population, and I have come firsthand with the experience that our population is actually getting when it wants to get some healthcare services from the public hospitals. And I believe this issue is an issue that should not be looked at in one side. One of the things that I've always been complaining about is the fact that I feel like our doctors are actually not on strike, because many of them have private practices and they are doing it in private hospitals. They are continuing with their work. So there is work that they are doing. But I feel also like there is a deliberate experiment on whether we should do away with public hospitals. Because this profession, we really need to look at how we are going to move forward with the issues of our healthcare in this country. Most of our level 5 hospitals can offer zero services. That's why you find KNH and KU Hospital and other level 6 and 7 hospitals being overwhelmed with the issues to do with the service. And I want to say that, yes, I agree with my good friend here that we cannot pay doctors enough. It is not possible. But I believe this is one of those professions that you take and you know you have taken the lives of people at hand. So there is a need to also be open-minded. And whatever is required on the CBA is not something that can be achieved with a blink of an eye. It is not possible. So I believe, and I stand to be corrected, that we need to define clearly what we would call a strike for doctors. We should not allow paralysis of our hospitals in the name of strikes. There should be a clear guidance on how emergency services, specialized services, and other services can continue being offered by doctors while they are still demanding their right, and they should be heard. I also don't agree with the stand that you stay there and I stay here. There should be that conversation, and there is a need to get into a solution as quick as possible. I want to believe that nobody should be happy when our people are dying. But I need also to say that there is a need to regulate this sector in a way that when you are a public doctor and you are agreeing to be paid this amount of money, let it not be that in the next door, plot, you have a clinic that you are running. So our healthcare system remains amorphous and is actually a cartel of sort that takes people from the public hospitals, takes them to private practice for the benefit of very few. So there is a need to look at these things. Yeah. And actually, I agree that nobody should stand like there is no lives that are being lost.
So at this point, everyone is on the wrong.
Everybody is on the wrong.